Hi everyone, Dr. Ariel Ostad, Cosmetic Dermatologist. It's great to be here with you. One of the common questions that always comes up is what skincare routine should I use? And skincare routine is an extremely important part of having healthy skin. And I just wanted to spend a few minutes to really give you my take on it. There are a variety of skincare products out there, but it is important that you use what we call medical grade skincare. Medical grade skincare is basically where the concentrations of the active ingredients are at their highest. Versus sometimes you can go over the counter and at a drugstore and still buy good products, but the concentrations are significantly lower. So you're not going to get necessarily the good results as you need. So always look for medical grade skincare. Usually you can get that at a physician's office or by prescription. Having said that, let's just go over my paradigm and my thinking process about what is proper skincare. The most important thing to do in terms of having healthy skin is to stay out of the sun. So sun prevention, sun avoidance is by far key. It's basically sun that causes what we call photoaging and leads to collagen and basically loss of elasticity, wrinkles, hyperpigmentation. So it is important to stay out of the sun as much as you can. If you're going to be in the sun, you want to make sure you wear your sunscreen. It is important to basically use a mineral-based sunscreen, something that has high concentrations of zinc, titanium. There are now sunscreens that basically can even block out the visible and the infrared light, which have been shown to also lead to photoaging. So staying out of the sun, using proper sunscreen, something that is not chemical-based sunscreen and avoids ingredients that potentially have been shown to be harmful to mice and rats in clinical studies. Mineral-based sunscreens really can avoid what we call avobenzones or products that can potentially be carcinogenic. So as we talked about, zinc and titanium-based products are the ideal sunscreens. And it's important to reapply sunscreen frequently. It's important to reapply it every 3 hours. Even the best sunscreens really lose their potency. Anything above an SPF truly 30 is really, I feel like it's redundant. It's been shown that an SPF 30 can block out 99% of the sun's rays, and it blocks out both UVA and UVB. Having said that, then we sort of get into basically proper skincare routine beyond sunscreen. And what I want to impress upon you is the importance of you really have to customize and tailor the skincare based on the condition that the patient presents with. It's based on their skin type. It's based on how sensitive their skin is. Whether do they have rosacea, whether do they have acne, whether do they have hyperpigmentation or dull skin. Before we get into that, I just want to tell you what aging is really all about. And aging, basically, once we go over it, then we can actually understand what skincare products can be used to tailor those specific changes that happen with aging. One of the first things that happens with aging is we basically get thinning of our epidermal skin, the top layer of the skin. That leads to what we call water loss and dehydration and therefore dullness. So that's one of the things that happens. As we go further down the skin layer into the collagen layer with aging, unfortunately, we lose collagen, we lose elasticity. We get a deposition of what we call elastotic material, which is kind of broken down collagen and elastin tissue. So it is important to have skincare products that address that issue. With loss of collagen, it further leads to wrinkles, dullness. One of the things that also happens with aging is basically we get hyperpigmentation, we get sunspots, we get increased deposition of what we call melanin in the top layer of the skin that leads to brown spots and sunspots. With aging, we also get loss of fatty tissue, where therefore leads to loss of support and therefore sagging of the skin. We also get stretching of our muscle layer, we get bone loss. But there are proper skin products with proper ingredients that can address those different issues that lead to aging. I try to keep the regimen extremely simple. We don't really make it complicated. There are sort of a handful of classes of products that can actually really make a difference in terms of helping the skin to look its most youthful way, with having nice glow, with having less wrinkles. One of those issues we talked about is use of sunscreen. That's by far number one. Number two, moisturizing. Proper moisturizers are really important. It's important to use a moisturizer that contains the right amounts of ceramides, basically lipids, proper hydrating agents. One of proper products is really niacinamide, which has been shown to reduce what we call transepidermal water loss and leads to proper hydration of the skin. There's also hyaluronic acid that's also been shown to be great. As we talked about, ceramides is really important. So there are different classes of ingredients, and one thing I'm proud of is we have a proper product that contains all those lipids, ceramides, niacinamide. We call it niacin in my practice, and it's been shown to really help with reducing transepidermal water loss, dehydration. So moisturizing is really critical. The second class of ingredients is using basically retinoic acid. Retinoic acid has been shown to help stimulate collagen. It helps to basically build elastic tissue, and it's been shown to therefore thicken the skin layer. It also helps to basically help increase the epidermal skin as well, the top layer, and therefore skin looks just more hydrated, skin looks better, less wrinkles, less brown spots. Retinoic acid can be prescribed as either Retin-A, or it can be actually put in products, a form of either retinol or different concentrations of retinoic acid. We have an amazing product in my practice that contains different concentrations of retinoic acid. We also have retinol, and that's been shown to really help stimulate collagen and elastic tissue, and therefore make the skin just have a nice glow. So a third class of products are antioxidants. Antioxidants basically fall into different ingredients, vitamin C being a well-known one, vitamin E. There's also polyphenols. There is ferulic acid. Polyphenols can be either in extracts of tea, and that's been shown to really help to reduce hyperpigmentation and brown spots and help stimulate collagen. We have an incredible product line that contains vitamin C, vitamin E, ferulic acid, and polyphenols as a form of green tea, and that's been shown to really help stimulate collagen. Lastly, another important class of ingredients is what we call growth factors. These growth factors are important factors that can actually grow skin in a laboratory. Now they've been put inside a bottle and can actually be applied to your skin. Some of these ingredients could be fibroblast growth factor, vascular endothelial growth factor, or even epidermal growth factor. And these ingredients have been shown to really help stimulate collagen. So these are generally the important classes of products. We talked about proper moisturizing, obviously sunscreen being the second thing, as well as retinoic acid. Then we talked about growth factors and antioxidants. These can simply be divided in morning and evening routines to help make your skin look its best. Again, medical grade skincare is really critical, and each of them address different aspects of aging, whether it's dullness, whether it's dehydration, whether it's hyperpigmentation, whether it's wrinkles, collagen loss. The important thing with regards to these is it has to be customized to your skin, whether you have oily skin, dry skin, whether you have rosacea, whether you have acne. So these are things that we can actually help you in the practice. We welcome you to either visit our website to learn more about these products. There is a tab in our website that can actually teach you about the different classes of products we have and what are the proper products that are necessary depending on your skin type and your skin condition. And then the other important thing that I wanted to just go over with you is ultimately a good skincare routine is only good as when you're consistently using it. So consistency is key. It is so important that you use these products the way they're indicated to be used on a daily basis. You will see results typically in about 2 to 3 months. And by staying with the course, that's how you can actually get outstanding results. I hope this kind of quick review was helpful for you. We're here to help, and if you have any questions, feel free to give us a call. I welcome you to visit the website. I'm proud of the skincare products that we have created here in my practice. Hope to answer any questions you have. Thank you.